Skill number 2 is shifting into left AFIR. Now, AFIR means acetabulum. This is where the leg, here's my leg, fits into the pelvis on the left side. That is the left acetabulum. So that AF, this is femur. So acetabulum on femur, okay? Left AFIR. IR is internal rotation. So what this means is the acetabulum, this left side of the pelvis, needs to internally rotate. So this is the inner side of the femur, has to rotate towards the inside of the femur. So it's internally rotating on the femur. At the same time, the left leg, the left femur, my eyeglass case, internally rotates on the acetabulum. These should happen pretty much simultaneously when we put our weight on the left foot. That does not happen when you're in a pattern. When you are in the left AIC pattern, your pelvis is oriented to the right and your femur is externally rotated to the left. It externally rotates in order to stay straight. If we didn't have to walk, we wouldn't have to compensate. But because we're in a pattern where the pelvis is oriented to the right and the femur, instead of staying oriented to the right, turns out in order to stay straight so we can walk forward. Otherwise, we would be walking diagonally. Now, when this left leg externally rotates and it stays there for too long, and maybe this is going on for years and years and years, and maybe you need even more external rotation of that left leg for your sport, for whatever you're trying to do, and the pelvis is still stuck to the right, what's going to happen is the ligaments that attach from the front of the pelvis, from the acetabular area, to the femur that check external rotation, that prevent too much external rotation from occurring, they can get stretched out. And when they get stretched out, they get weakened, and the whole hip joint in the front, the whole left side is weak. And you can feel this in a lot of people. Their leg, you know, you're testing them, you lie them on their side, you bring them back for the adduction drop test, and it's just, there's no tension in that hip. The rest of their body's tense, and they're in pain. But this hip is so weak, the leg is just flopping. And you really have to stabilize that joint to then bring the leg down. So left AFIR has not occurred for these people for a long time. And in fact, because of that, the front of their hip capsule is usually stretched out. I would say most people have especially if they're remotely athletic, most people have stretched out hip capsules in the front on the left side because of this issue. So skill number 2 is having the ability to effectively shift into your left hip or into left AFIR. So skill number 1, make sure you watch that video, was get off your right side. Drive your pelvis towards the left. You're going to need a right arch and a right glute to do that. If you can't unload your right side, you can't get to the left. If you can effectively unload the right side, at that point your pelvis should orient to the left. Now you're switching into left AFIR. Heel strike. This pelvis should start to orient to, before the heel strike, this pelvis will already start to orient towards the left. Heel strike, it should happen even more. Heel strike gets the hamstring kicked in. The hamstring attaches to the pelvis, starts to pull. At this point, the pelvis is still forward on the left. It's orienting to the left, and then the hamstring kicks in. It starts to pull that pelvis back and in, and that is what provides left AFIR, is that hamstring pulling the pelvis back on the left as you make heel strike, and then the left adductors and glute medius have to kick in to internally rotate the left leg, the left femur, into internal rotation on the pelvis itself. Once your arch comes down, heel strike, arch, that's where most PRI exercises are getting you to. And you'll have a flat foot, you'll have a brain that's that is sensing the ground through a medial arch on a pelvis that is neutral or in left AFIR. Again, adductor glute medius, anterior glute medius are stabilized in the pelvis. You'll have your left COA. So this rib cage, so here it goes to the left. You're in left AFIR. the rib cage orients to the left, side bends to the left in the frontal plane, and then up top starts to counter-rotate back to the right, and your left arm starts to come through. And that is left stance, and that is what PRI is really trying to get you to be able to stabilize. And we are challenged because humans prefer the right. We got more muscle over there. We have that bigger right diaphragm. Neurologically, we just like to use the right side better. We're always reaching with our right arm. There's a lot of reasons that 90% of the world is right-handed. We are righties. Whether you're lefty or righty, you're righty, okay? So the ability to shift into left AFIR and then stabilize. And I'm not even going to stabilize, that's probably a different skill. Just getting left AFIR. People get stuck. They're on their right leg. They're coming through. Their heel hits the ground. And I'm working with a golfer right now, and he knows he cannot shift into his left hip. He could describe it, but he had no clue what was going on. He would get here, and when the pelvis was supposed to move back on the left after he's exiting his right foot, his left foot makes contact with the ground, this left pelvis would never shift back. So his pelvis would never orient to the left, so he could never actually get into left AFIR. So he's still stuck on his right side, even when his weight is pretty much on the left side. Biomechanically, his weight is not on the left side. He's not really on his left foot until he can get AFIR. If you can't get that, biomechanically, you still got that left leg a little externally rotated and a pelvis that is still kind of oriented to the right. So you're not truly on your left leg, even when your weight is on your left leg, you're still exhibiting right stance. And in fact, you'll see a lot of people putting weight on their left leg and their upper body is still over to the right. So skill number 2 is shifting into left AFIR, or better yet, I'll say exiting right stance at that transition zone, getting into left AFIR, and that is skill number 2. And that's what most of the most basic PRI exercises are trying to get you to do by restoring proper position of that left pelvis, by bringing it back, orienting the pelvis to the left, and then internally rotating the left leg on that pelvis. If you found this video interesting or helpful, could you please like it, share it, subscribe to the channel, do anything you can to spread this information, because PRI is really changing people's lives, and I hope to share it with even more people. Thanks.